medicine is quite large. It's about 50% of the university as a whole. We have 1,000 faculty. We have 21 clinical departments and 8 basic science departments. And we are really very integrated with the school. For example, with the university. For example, School of Medicine faculty and students have an opportunity to work with those in the School of Architecture to help design healthy communities, or help design buildings that don't transmit diseases regularly, infections and such. We have groups of students who get together in the summer and try to redesign the clinic setting so as we have computers on the desk, we don't take away from the patient-physician interaction. So we have so much creativity. The School of Medicine has dual programs with the School of Law. As mentioned earlier when we talked about this college, Dr. Hunter's college, bioethics is truly amazing here. We have some of the premier bioethicists, and students have an opportunity to interact with those. We work with the Darden School of Business to work with efficiencies in healthcare and leadership training of both students and faculty. One of our major interactions, though, is with the School of Engineering, and it's a really interesting situation. We are one of 3 universities where there is a Department of Engineering shared by the School of Medicine and the School of Engineering. That's our biomedical engineers. And what is so fascinating there is there's a totally different way of thinking from engineers to medicine. And when they get together, sometimes the language is a little bit awkward. But when they actually connect, the excitement and the ability to see things from a different perspective just creates excitement and enthusiasm. So our students are truly self-directed. You can tell from the arrhythmics that there's a lot of energy, a lot of rhythm in our students. But there's tremendous opportunity throughout. And so the students are sort of self-directed in a way. We certainly want to be sure they have the skills and tools to become outstanding doctors. But we want them to really understand and explore that in this time of change in healthcare, that the medical degree has a lot more impact than just taking care of patients. It really is helping to change society. And I think our students will become leaders in those areas. So as I sort of reflect back, I'm going to have another dinner at my house soon, and hopefully I'll get to meet all of your students. But I do want to thank you very much, because it is really the students that add such energy, creativity, and excitement to the job that we all do as faculty. And so I hope you know that we will take very good care of everyone. So with that, I would be happy to open it up to questions if people have any questions.
Do you offer a leadership class? Or an advocacy class, or politics and leadership for people to cross and do that bridge of public health?
In the School of Medicine, there is a Department of Public Health, and we actually do quite a lot. There's a lot of global health that goes on. We have about 50 students that do international experiences, caring for patients in Rwanda, doing experiments in Africa, those type of things. So we have about 50 per year that are going for international experiences with the School of Public Health. There are several students who take courses at Darden. You can actually have a dual degree program. Darden is our business school. We have a health policy program, and I think, I'm not sure which year, but the 4th year, there is a health policy program, and actually I spent some time in Washington, D.C. In the House of Representatives, and some of my friends are coming over, and we're going to teach a class to the students, and I think that should be quite fun, but it really tries to get you, get the students where they are aware of what's going on nationally. So there are opportunities there throughout, and I think that if they talk to their deans, there's certainly ways to connect with all these different programs, lecture series, events that are going on throughout the university. May I ask one question? Is there someone from Brevard, North Carolina? Only reason I ask is a childhood friend of mine, her former name is Betsy Keenan, has a son in this class, and I can't find her. So I don't know what the last name is, but when I was young, I decided I wanted to be part of her family. My mother sort of just smiled sweetly, knowing that they would never take me on. So I was just hoping she would be here. But, any other questions? Yes, you're back.
I wanted to know if there was any educational opportunities for the students to learn the business of medicine and how to establish their practice, and whether or not that started now or if it's done later during residency.
It tends not to be a formal class, but there are opportunities, again, with that link with we have an undergraduate business program that actually the dean is led by someone who ran a hospital, so it has a lot of opportunities there. And we have the Graduate School of Business, the Darden School, where there are opportunities. But I don't think that we have taken full advantage of that, and I do believe that that is more and more important. As mentioned, I actually got my MBA because I was running a large ambulatory clinic in Birmingham, Alabama, and realized that the tools and skills of business are very important now in healthcare. And so if your student has an interest in that, I think we can figure out a way to link them with groups that can help train in that respect. Are there any other questions? Yes?
Is medical school being impacted in any way by all the changes in their policies?
Yes. The School of Medicine, we're really at a very interesting time because never in modern history have all three missions, clinical care, education, and research, been simultaneously threatened financially. With the Affordable Care Act, the payments for individual medical services are decreasing. There may be more of them, but the individual units are going down. Sequestration particularly has hit the NIH budget, so our research scientists are more stressed than they have been in the past. And education is also threatened. You may know that graduate medical education slots have not increased as the number of medical students have increased. So there's sort of a bottleneck there. I think all medical schools are struggling to figure out where they're going in the new world. And I think that medical schools are probably going to tier out. And this is my opinion, so please don't say this is UVA's message. But I do believe that with the workforce pressure to get people out and practicing, there are going to be some medical schools that are trade schools, where they're just trying to get practicing physicians on the front lines. And I think there are going to be academic medical centers where they train the leaders of the next generation, leaders who can think scientifically, who understand practice in a way that's more comprehensive, that really can lead discovery and innovation in medicine. UVA wants to be one of those academic medical centers. So we are actually trying to position ourselves where we can look at our strengths, change our processes to be much more efficient, but maintain that goal of really training the leaders in medicine for the next generation. So I think we are very blessed here. We have a wonderful faculty. We have tremendous strengths, and I think we have a committed group that is really wanting to maintain. So I don't know if I answered your question. Are there any other questions? Well, I do thank you for entrusting us with your children, and we certainly enjoyed it. Thank you.
Thank you, Dean Dunlap. Now it's time for our fourth-year class president, Nicole, to cue up her presentation on student life. And we have 6 students.